All right, hello everybody. I am Erin Kreszl, Executive Director of the B Foundation, and I'm so excited to be joined today by Dr. Burkhardt from Penn Medicine. So hello, Dr. Burkhardt.
Thank you so much for having me. Hi.
Jan is the newest member of our scientific advisory board. He joined us in April of last year and joined our existing board to kind of bolster our efforts in the area of brain aneurysm research. And we're really excited to have him with us. Jan is actually part of Penn Medicine, as I mentioned, and so he's very close by to the local office of the B Foundation. I also want to mention that Jan will be our speaker at our upcoming Golf and Gala on October 12th, so we're really excited to have him with us for that day, and he's also a local resident here in Gwinnett outside of Philadelphia. So I'll turn it over to you, Jan, to give an introduction and just tell us a little bit about who you are and maybe tell us how you got into medicine and more specifically neurosurgery.
Sure. Thank you so much. I'm happy to give you a quick summary. I try to keep it short. So my name is Jan Burkhardt. I'm originally from Europe, from Germany. I did most of my training actually in Switzerland, and I went to medical school in Germany and did my residency in Switzerland. The thing fascinating me about neurosurgery was always that it has a lot of different subspecialties. So there's not only brain aneurysms, but there's also spine, there's tumors. And actually during medical school, first I thought most of these diseases are not treatable. And I was very amazed to see early on that there are great options for patients who suffer from diseases of the brain and spine, and that we actually can help the patients. And also, I really like surgical techniques and skills. So that was a really good combination for me, the neuro plus surgery. And then moving forward, after I graduated in Switzerland, my neurosurgery residency, and I stayed on for a few years as faculty, I decided to really focus more on vascular neurosurgery. That fascinated me because there were a lot of young patients suffering from diseases who are actually curable, and that I really enjoyed helping younger patients, especially coming back into their jobs and their daily life. And in Europe, the subspecialization is not as advanced as here in the US. So I decided to come to the US, and I was very lucky to do a fellowship with Michael Lawton at UCSF and then also at NYU with Howard Rina in the radiology group to really subspecialize in vascular for open and endovascular. And also my wife is from New York, so for us it was also great to come back. And then after a few years spending at Baylor as faculty, my chairman became new chairman here at Penn, so I joined him here at Penn. I'm very happy to be local here in Philadelphia. Also for my wife being closer back to New York and also enjoying like all the opportunities we have here at Penn, also in terms of research and clinical care for our patients.
Oh, that's great. Thank you for that overview. It's definitely noble to go into such a wide field. For some of us that might not, know all of the details of some of the subspecialties, tell us a little bit more, just what does it mean when you say neurovascular? What are the diseases we all think of that would fall under that?
Yeah, neurovascular is actually a wide range of diseases, different diseases, and involves different also medical subspecialties, not only neurosurgery, there's also neurology, anesthesia, intensive care. Also, our PCP physicians are very important to find these patients. And diseases could be, for example, aneurysms, so out pouches, vessels in the brain, but also arteriovenous malformations, so malformations of vessels. Then there can be any sort of hemorrhage, either related to an aneurysm or not. It can be blockages of vessels, which we call usually stroke or ischemic stroke. There can be narrowing of vessels, either through atherosclerosis or inflammatory diseases like moya diseases. And so there are different treatment options for all these patients, and they're very individual. We have endovascular treatment options, so mainly occlusions of vessels like ischemic stroke, we treat endovascularly. And then there are also lesions who are more for open surgery, like vascular malformations or cavernomas. And then for aneurysms, it's in between. Most of the time we treat them nowadays with minimal invasive endovascular technique, but also some aneurysms remain for microsurgical open surgery.
Okay. And do you do both endovascular and surgical for aneurysms?
Yes, I do both.
Okay, great. Obviously, here at the B Foundation, we bring a board of neurovascular and neurosurgeons, neuroradiologists across the country together, and you all help us with our annual preventative research grant that we give to up-and-coming researchers and pilot studies that really focus on prevention of brain aneurysm. So can you just tell us a little bit about how you would describe the landscape of brain aneurysm research today?
Yeah, so it's interesting because it's a disease which we know about for a long time, but there's not much known in terms of research why it forms in specific patients. We know quite a few risk factors now, but in terms of preventive measures, it's very scarred, the literature, to know what to do and what not to do. We know, for example, that risk factors affecting cardiovascular risk factors are pretty similar to brain aneurysms. So smoking, blood pressure management are very important. But then there are also other factors, like some patients, it runs in families. Mm-hmm. And the only thing we can do is screen these patients early on for aneurysms. So that's why I think it's very important to support research in this field and also try to find out what the reason is for formation of aneurysms.
Definitely have been thinking about that and battling that for a long time. And as you know, we really focus primarily on looking at different non-invasive ways to identify brain aneurysms. If you were talking to someone generally and just had one piece of advice that you could give to somebody who may be experiencing some of the symptoms or just concerned about it being in their family, what would be a piece of awareness or advice you would give to somebody?
I mean, unfortunately or fortunately, these aneurysms don't cause symptoms unless they burst and cause a hemorrhage. So then the most common symptom is the worst headache of your life. Obviously, if you experience that at any point, you should always come to the ER. But most of the patients don't even know that they have an aneurysm. It's not very common. So, but if there are any risk factors, as you mentioned, family risk factors, we usually say 2 family members within 2 generations, then you should definitely do screening. And I think there are good screening options, especially with MRI. Without radiation, you can get an MRA and screen for aneurysms if there's any doubt.
Right. And would your recommendation still, is it consistent to say 2 or more direct family members and that would lead to screening?
Yes. I mean, I'm sometimes recommending it earlier if it's only one family member plus other additional risk factors, let's say smoking history or high blood pressure, then it makes sense sometimes to screen earlier or for specific individual patients. But the guidelines are still saying like 2 generations.
Great. Well, thank you. This has been really helpful. We're really excited to have you be part of the team and help guide us and with our future research grants. We have a really great team of doctors, and we're just so happy to have you as part of the scientific advisory board.
First of all, I really like your team. Is amazing. There's such great people to work with. It's local, and I'm really happy to do whatever I can for awareness for aneurysm prevention. And I'm also looking forward to the events you're planning.
Great. Well, again, thank you for everything. And we're really excited to have you at our event this upcoming October 12th. So if you're able to come, you'll be able to meet Dr. Burkhardt there. All right. Well, thank you again. And hopefully we'll be seeing you soon.